we are going to discuss the important topic in cardiac equipment, that is cardiac ablation. So the learning objective of today's class is that we are going to cover in and out of cardiac ablations, right from introduction, types and procedure, and what are the risk and complication of cardiac ablations, and future trends, finally clinical evaluation. So why the cardiac ablation? So before getting into the main concept of cardiac ablation, first we have to see the empathy perspective. What is the reason, what is the need to have this particular topic here? So the reason is that if you see there is a case called arrhythmias, right? You already know what is the meaning of arrhythmia. So arrhythmia is the abnormal heart rhythm. It represents your heart disease. Okay, so these arrhythmias, it's being affected million of people these days, and if we are not giving the immediate attention to these arrhythmias, ultimately it will end up with serious complications. So that is the reason there is a great demand to devise some sort of technique or a method to target the heart which producing arrhythmias, to treat it in such a way to restore the normal rhythm. So you may ask question whether we don't have any other techniques to correct this. Yes, we have so many techniques. One such of device is called defibrillator. We have already know that these devices will mainly use for correcting the arrhythmias like ventricular fibrillation and atrial fibrillation and so on. So but that is totally different, which is non-invasive one. But here the cardiac ablation, that is as a solution here we have brought out for the problem statement, that is invasive one. Okay, that is minimally invasive one. Here we are going to localize the target of the area which producing the abnormal arrhythmias. So after doing so many brainstorming section, being collected so many ideas, they finally come up with one technique which is called cardiac ablation, which is meant to target the tissue, heart tissue, which is being produced, which is keep on producing the abnormal rhythms, that is called arrhythmias. Okay, so now we'll move on to what is all about cardiac arrhythmias and cardiac ablation catheters, and how does it works, and what are the different types of arrhythmia which we can easily treated with the help of this. So the cardiac ablation techniques, which highly depends upon one tool, that is the catheter, because through this catheter only we are going to pass the energy, that is a source of energy to treat the abnormal tissue, abnormal heart tissue. So this catheter is a flexible tube which is meant to treat the arrhythmias, that we are going to insert it by means of minimal invasive procedure through the blood vessel. So once it's been inserted, from the outside the physician or the doctors will set the energy what we want to deliver are good enough or strong enough to treat that abnormal tissue. So once the energy is set, it delivers the energy to the targeted tissue, and then it will start working on it, and finally it will destroy the abnormal tissue, which leads to the abnormal heart rhythm, that is the arrhythmia. So different types of arrhythmias we can able to treat in this method. One such is atrial fibrillation, supraventricular tachycardia, ventricular tachycardia. So now we'll move on to what are the different types of ablation procedures are there. These different, all four different types, mainly based on the types of energy what we are using for treating the ablation. So the word itself, the ablation, is nothing but it's a destroying, it's all removing. That is a word that it's a key point you have easy to remember. So ablation is that we are going to destroy the abnormal heart tissue which are producing the abnormal heart rhythm. Okay, so in what way we are destroying is the matter. So here we are sending the energy, that is the main thing. So based on the type of energy, we have four different types: radio frequency, cryoablation, laser ablation, pulse field ablation. So radio frequency, here we are having the principle of producing heat to destroy the tissue. Cryoablation, that is the exact opposite. Here we use the very low extreme temperature to freeze the tissue, mainly used for pulmonary vein isolation. Compared to the heat, it produces very less tissue damage. And laser ablations, even though it's very trendy type of or recent type of technique, here we are using the laser energy to treat the tissue. It is less commonly used because of the expensive. But even then it provides high precision compared to all other three techniques. And finally we have the pulse field ablation. Here we are using high voltage pulse to treat the tissue. Here this is the non-thermal technique. It means that it will not dissipate any sort of heat to treat the to treat the abnormal tissue. So these are the four different types of ablation procedures. And in equipment aspect, what are the inputs and output and how we will do monitoring? These are the things we have. We are going to see now. So the input for the device, technique is that here we are going to give patient data, and then we have to do the electrophysiological mapping, which is mainly important for the catheter to navigate. Okay, that is the imaging guidance to navigate the catheter to locate it in a proper targeted area. So that is the things where it's very much important before starting the equipment. So that's why we are considering as an input. So we are electrophysiological mapping, which helps to navigate the catheter to place it on a targeted area. So what sort of output you will get once that it's been settled, the energy will be delivered based on the what type of energy. We have three option of selecting the four different types of cardiac ablation techniques are there. Based on the energy we will select it, and then once everything is done, the output what you get from this technique is that successful ablation. That is, you can see beautifully normal rhythm, just keep on restoring as long as you are giving the energy to destroy the abnormal tissue. And finally, you have to do the post-ablation monitoring by means of ECG, whether your ECG is in normal or not. So this is how the input or output goes hand in hand for cardiac ablation technique. But there are few chance to get a complication like arrhythmia recurrence, vascular damage, and pulmonary vein stenosis. So these are the common problems, and also we have a solution for that. That is a heart perforation, blood vessel damage, arrhythmia recurrence, and stroke. So and also we have a respective solution in each of these. For heart perforation, that is, which is nothing but the damage to the heart wall during the catheter placement, that we can be addressed by using careful mapping. That is the very important, right? Careful mapping and ultrasound guided insertion also you can go with. So or surgical repair, if there is any repair, any tear or over there, then we have to do the surgical things. So these are the solution we can do it to overcome those problems. Similarly, we have each and every problems we have followed a solution that we can do it to overcome or suppress the common problems. So these are the different imaging and mapping techniques we can use it for cardiac ablation techniques. One is fluoroscopy, intracardiac echographic, magnetic navigation, and 3D anatomical mapping. So the future trends, as we said, it is a minimal invasive technique, and we can use it for even for robotic and automation, for remote controlled robot navigations, and novel energy source. Okay, we for the energy source we can use ultrasound energy delivery, microwave ablation, non-thermal techniques. That also we can go with other different types of energy to use for ablation, and advanced mapping, because the mapping is a very crucial in this. So what are the different technology we can integrate to make it advanced? That is what here advanced mapping, that is AI integration and predictive analytics for outcomes. So finally we have the advantage and limitation that already we have discussed in previous slide. That is, many advantages: the minimal invasive, high success rate, reduced need for medication, and improved quality of life. And in same way we have a few limitation, and also we can overcome the limitation by doing some careful mapping or careful selection of doing treatment and so on. So this is a student activity role play that we have played on this particular topic during class time. These are the few assessment questions that we can read out at last. The finally this is the mind map of this particular topic I have given here. What is cardiac ablation, introduction, types, and then we have a procedure components like what are the inputs and navigation guidance, and then future trends, and finally clinical evaluation. Thank you.